Well, hello. My name is Charles or Chuck Enck. I'm professor and chairman of the Department of Radiation Oncology at the University of Nebraska Medical Center, welcoming you to learn a little bit more about our program as you're engaging in the residency selection process. We look at residency education as something that is really important and something that we have to be able to deliver on.
I had the advantage of going to medical school here, and so I got to be around the department, throughout my medical school years a little bit. And from that experience, I think seeing the working relationships between the physicians and all the other staff in our department and between our department and all the other departments, I think the culture was something that really appealed to me. Everybody was kind of treated as if we're all on the same level. There's not really as much of a hierarchy as you would expect sometimes maybe from other programs or other places around the country.
We look for residents who are team players, who really work well with other people, whether that would be our staff, nurses, and therapists, other residents both in and outside of the department, working well with attendings and colleagues, medical oncologists, surgical oncologists, and so forth.
When I'm interviewing people for a position in our department, I tell them that we're interviewing them to become part of our family. And that really is, I think, the pervasive atmosphere that we have in our department. One of the features that I really like about our program is that we do have a very active brachytherapy program.
Our residents are offered a broad clinical exposure to radiation oncology. They really see many different types of cases, from pediatrics to sarcomas. Every disease site is covered here. We have a multidisciplinary approach with experts in their field across all different disease sites. And residents really get to see everything from the beginning of the diagnosis to the end of their radiation therapy. If they seek it out, we have a cancer center here from bench research, translational research, clinical research. And so I think we've got a broad offering for residents who are interested in pursuing that aspect of radiation oncology. And then if residents want to be part of the teaching, we have programs for that as well.
From the day you show up in radiation oncology, I think most people's experience is that it's very new and very different from anything you learned in medical school. And over the years, you spend a lot of time learning a lot of the clinical aspects of it and a lot of the practical aspects of it. And as each year goes on, you get a little bit more autonomy every year, where your attendings kind of give you more independence to make decisions, and where they kind of listen to your decisions and actually take them into consideration, where maybe they'll actually start using your plans and your recommendations.
If you contribute your part, I promise you we will deliver on your education and make certain that you are able to have success in your career.